Good afternoon. Good afternoon. I think without this mic also I can manage. See, there is a small hall. I think that may be more comfortable. If you could able to hear me without this mic may be echoing. However you feel comfort. You followed? ये माइक के बिना मैं बात किए अगर कोई आपका इतराज नहीं रहा तो why? You want mic. My dear friends, colleagues, how many are students here? Please raise your hands. Well, Tibetan medicine students, good. I wish. Today we are here to understand something you are hearing now previous to this session, where individualization is the basic principle behind the selection of any medicine. Individually, each one is different, though they have born in the same uterus at a time as a twins, they have a different in their genes as well as expression, desires, aversions, likings, dislikings, and so many things. Means when individually they are different, naturally their remedies also may be different. That is the basic concept. See, though we all look like a human beings, or I can just tell that many Tibetans all look like the same. If you see from a difference, they look like the same. If you go near, then you could able to identify the differences. Each individual is different in their expression, in their face, in their eyes, in their desire, in their likings, dislikings, or expressions, psychologically, physiologically, and so many factors. See, all together all these factors to consider the diagnose without any investigations, with the expression of their sufferings, how best we could able to understand or identify the persons in a different ways, and we have that discussion today with you. That is, this is my address. You can note down the mail ID. You can keep in contact. Certainly, I will be very much happy and comfortable to have an interaction with you through the mails. It may be more useful for me instead of you, where I can learn from you. It is a sharing session, I will tell you. It is not one way. Okay? You are all here to teach something, to learn something, to share something, and to take away something from the session. Diagnostic criteria in homeopathy, see where I have selected. See, this is the basic principles. Now he was talking, I think in the introductory part only the many things have gone. To identify the simillimum, this word is a new for you. Similia similibus curantur, that is the basic principle of homeopathy. Similar corrects similar. That is the basic principle of homeopathy, where the Hahnemann has found this is the latest system, hardly some 200, 260 years old history, not more than that. In this, these are the three main important factors we identify. Number one is individualization, is what in the first session, the plan session we are discussing. The number two is a totality of symptoms, and number three is miasms. Individually the person differs, and totality of symptoms means it is altogether the expression of the, even I think these slides can be made of, these lights, then it may be more clearly visible. Front lights may not be required. Totality of symptoms means in toto, including their mind, will, understanding, emotions, physical, pathological, as well as other factors. Altogether, what is the expression of the patient is there, that is typical what we express as totality of symptoms. Altogether expression. Then only you could able to come to the simillimum what I am talking. And to identify the simillimum, one is individualization, number two is totality of symptoms, number third is miasms. And these miasms I am going to discuss with you. Okay? What is these miasms? Miasms are the foundation of all chronic diseases. This is understanding. Where during the time of Hippocrates only, he mentioned, Hippocrates was the first physician to use the term miasm, which has its origins in the Greek word for taint or fault. Either taint or fault, each miasm's nature is expressed physically as well as mentally and emotionally. Where I remember in the earlier session, one of the learned doctor was asking, what is the role of mind in homeopathy? It was really a very interesting and very mind blasting question, I will tell you. Without mind, no human being exists. And we consider all the other persons without mind is like animal. That existence is different. And this is how we understand this miasm, which has been identified and introduced. Either with a some taint or with a fault, then only the disease starts. That is very interesting. I hope you are following me. Each miasm's nature is expressed in all the ways. Here in brief I have written physically as well as mentally and emotionally. And how it can be classified or discussed for the purpose of identifying the diseases, we will read that. Okay? Hahnemann, I think this name you have heard. Who is this Hahnemann? Yeah, very good, founder of homeopathy, a German physician. Earlier he was a modern medicine physician. He was not happy with the developments then taking place or the nature of methods, what they were using, crude methods. He came out of that and he has actually found or did a lot of work on this. He is a founder and father of homeopathy. In Hahnemann's words, he expressed this in his Organon of Medicine. This is a philosophy. You have any such books in a Tibetan medicine like a philosophy which has been called, like Ayurveda they say Sushruta or Samhita, Charaka Samhita, like that. See, Urdu they have some Tibi medicines like that. You have any book called or any author? What is that? Okay, good. Like that, this is that Organon of Medicine. Means it is a basic principles which has been written in the form of aphorisms or in Samskrita Vishesh Lokas, no, but they have written in German language that has translated to English. See, 78th aphorism, that symbol is used for, see the 78 and the symbol is used for the aphorism, means it is the numbers. Like that we have a total some 294 aphorisms are there. In his words, he says the true natural chronic diseases are those that arise from a chronic miasm. When left to themselves, improper treatment go on to increase, growing worse and torment the patient to the end of his life. Once this taint or that fault has started, it continues. It goes with the different phases of the disease as well as physical disturbances. That is the understanding of this, and it starts. Here I am discussing with you today only the chronic form of these miasms. We have acute miasms. Acute miasms may come and go, or sometimes the acute miasms we discuss in a diseases like a epidemic diseases like a whooping cough, chicken pox, the smallpox, all these things were there, that all comes under goes, and once in a lifetime it may come and lifelong immunity may develop. That is a different issue. Here I am talking about the chronic miasm, which is a chronic taint or a fault. What is that? See, Hahnemann almost he could able to spend 12 to 13 years to understand the miasms and collecting proof of his findings, the results of which can be found in his work, The Chronic Diseases. It is a book written by Hahnemann, Chronic Diseases, where he explains very classically regarding all these miasms and miasmatic expressions. And this is named the three basic miasms which has been identified by Hahnemann. Number one is Sora, the P is silent here, psychosis and syphilis. Sora, psychosis, syphilis. Later, his disciple J.H. Allen has identified the fourth miasm, that is called pseudosora or tubercular sora. That is actually additional thing. But initially there are three. One is sora, other one is psychosis, other one is syphilis. And we will give a small light on these factors. What do you mean by sora? What do you mean by psychosis? What do you mean by syphilis? See what this, I am showing some of these figures, no? I think you may be surprised to see this. In every slide, I think you are seeing that is all actually sources of our medicine. The different plants. We have a understanding like that. In the universe, whatever the things are available, from the air to the light, sun, moon, sea, sand, earth, chemicals, poisons, anything, any damn thing you say, which has a capacity to alter the health of the person, and that has got a capacity to cure the person's disease. That is a basic principle of homeopathy. That is similibus curator, which has occurred because of the poison, that can be corrected with the poison only. That is a very clear understanding of the basic principle. Disease is the vicarious embodiment of some miasmatic influence that has bounded itself with the life force, or it is called vital force, producing disease according to the type as seen in sora or any other of the chronic miasms. Here I will put a small light on the word, this vital force. I think you could able to make it life force or a vital force. In every science we have something called this life force. In Ayurveda they called prana. In Chinese medicine they call chi, that is life. And here we use the vital force, or that professor was using the word jiva. I don't know what you use the word. In Tibetan medicine, a life force, a life energy, prana, jiva. Because without that there is no life. Without that there is no life. That is very understanding. This vital force, for example, how we can put it vital force? When the vital force is deranged. It is a natural harmonious process which keeps the body in a good condition. When the vital force is deranged in its harmonious flow of its actions, it's a vital energy which is flowing, which cannot be seen, which can be experienced. How you experience the current, the power. Can you see the current? But you could able to see the expression of the current. Yes or no? You see the current through the light, fan, or all these electronic instruments, but can you see the current? No, you can experience it like that. This vital force is like that. I think I gave a very classical example to understand that. This life force is like that. Without that life force, without that vital force, no human being exists. And when the vital force is deranged, then the disease occurs. That's what he was talking, and behind that, these miasms are there. And the fact is, we cannot select the most similar remedy, the simillimum what I was expressing, possible unless we understand the phenomena of the acting and basic miasms. For the true similia is always based upon the existing basic miasms. Without these miasms, we may not able to understand the patient properly, and always when the person is sick in a chronic diseases, miasmatic influence is always there. Now, one by one in brief we will discuss, because each miasm may take more than 10 to 15 classes. That is different. In brief, I would like to touch and say something about these miasms. See, sora. Sora, actually the word meaning sora is itch. Against the internal itch, disease with or without its attendant eruption on the skin. See, how many understand Hindi here? How many understand Hindi? Majority? No. See, it's not a meaning of the itch means like a khujli or something. Without itch is a desire. Without itch, no person exists. I could able to correlate like you have a itch to understand the different system of medicines. You are here for this national seminar. I will put it in that way. If it is within that, it is fine. If it is exaggerated, that is disease. You followed it. See, here what happens? What are the manifestations you see in the sora? Number one is the functional changes. Functional changes means when we say the functional changes, it may be a psychological or it may be a physiological also, or it may be a pathological also. You followed it, where psychopathological changes, which is at the level of functional disturbances. I think I will explain in this after completion. Itching, burning and inflammation leading to congestion. Itching, burning, inflammation leading to congestion. And what are the expressions we see in the soric persons? They are like that. The philosophers, selfish in their nature, they are very restless, they are weak, they have fears, their pains are neurological type, and pains are sore, bruised, humiliation, rest and aggravation motion. Still further I will put a small word for these functional changes. All you develop some sort of disturbances, and that is functional. You get corrected yourself with or without medicine, and your organs or the system comes back to normal in its own phase. Okay, with or without, with support of the medicine or even sometimes without support of the medicine. And that is typically, that's why I said the functional changes, even the pathological changes, where the person develops a diseases like a pneumonia or any such disorders. I am giving an example, but without any remnants, without any scar marks, without any residue, they recover. They recover. That is typical. That's why I said the functional disturbances. It is a first phase of any disorders which takes place. That's why the Sowa, we call it as a fundamental miasm. Without that, or without that phase, no other miasms can occur. That is initial phase. Any such discomforts are there, as we said, it is burning, itching and inflammatory changes. Later, it may go into a different in its expression. Then, next miasm is psychotic miasm. In a one word, I can say, it is in its expression accumulative, extra growth, enlargement. I have kept all these things in a very small and concise form. Collection of mass and liquid. Or still further, that can be added overproduction, growth like warts, condylomata, fibrous tissue, and it attacks internal organs, pelvis and sexual organs. There is understanding during the era of Hahnemann. He mentions psychotic and syphilitic miasms are transmitted either through the sexual act or sexual thoughts. That was his understanding. Now the lot of changes have taken place. Even without that also we identify all these things. Otherwise, these two, psychotic and the syphilitic, next two miasms considered as it is transmitted from or expressed from the sexual act. Here, can anyone give an example? I gave so many things, but without naming any disease. Now, can you able to tell any name of the disease? I said accumulative, extra growth, enlargement, collection of mass and liquid. Can you suggest any disease name which comes under this psychotic? Tumor, very good, tumor. Tumor of any origin, you are right, either it may be a malignant tumor or because in the tumor what happens? There is increased cellular mass, increased growth, that is tumor, good. Then any other disease? See, extra growth of any nature. It may be a nodule, it may be a wart, it may be a condylomata, it may be a lipoma, any such disorders. And enlargement means what? There also the increased the mass. For example, liver gets enlarged, spleen gets enlarged, heart gets enlarged, prostate gets enlarged. See, that all comes under this category. I hope you are following me, what I am talking. See, overproduction, even the overproduction. See, growth like what's called fibrous tissue like a fibroid tumors, fibroid adenomas, fibroid tumors of any fibrous tissue from the body. Maybe fibrous tissue in the breast or in the uterus or in the ovaries, anywhere, and pelvis as well as the sexual organs, and all the hollow organs which has a capacity to increase in its size to accumulate either a solid food or a liquid. See, for example, to say the ascites. Ascites means what? Ascites means collection of fluid in the peritoneal cavity. The abdomen gets enlarged because of the collection of fluid. That is ascites. Like that. I gave one simple example. Maybe because of the varied other causes and the reasons we find, or whole cardiovascular system, that is tubular things. And even otherwise also the hypertension and other cardiac diseases comes under this category because tubular organs are involved and there is a structural changes which may take place either because of the addition factor or a thickening or the growth or collection of the things. In that also what happens in the hypertension with the cholesterol and other things, there is excessive deposition of the either cholesterol or thickening of the blood vessels. All these things occurs, that is typical psychotic miasms. And a diseases like a formation of the stones, gallbladder stone or a renal stones, kidney stones, all these things are also the extra in its origin and expression. Then what is the nature of pain? In general we see in the psychotic persons, the pains are joint pains, rheumatic pains and aggravation by cold and damp weather, amelioration by motion, amelioration by stitching, amelioration by pulsating, amelioration by wandering. Amelioration means which reduces, pain reduces, pain reduces. And this is a third, the syphilitic miasm. See, in one word I can say its nature is destruction. Number one, functional disturbance, Sowa. Number two, there is excessive growth which may remain, which may disappear. But number three is, see, congenital disorders. All the congenital disorders means either during birth or before that only, intrauterine growth only, there is a discomfort. That is typical congenital disorders. All the congenital disorders and destructive disorders. Destruction takes place. Initially what I said, in the Sowa, there is a congestion, there is a itch. Next phase, there is a growth, the extra growth, accumulation. Third portion or the next is, there is a destruction. Initially there is a congestion, ulcer formation. Ulcer formation gives rise to the some growth or that, then later atrophy may take place or these ulcers may become ruptured and puncture may take place. What I say, that is typical destruction of the things. And ulcerations, fissures, deformities, either it is congenital or acquired deformities, and ignorance, they are very suicidal. Suicidal, why I am using the suicidal word? They are destructive. Destruction is there not only at the physical level, it is there at the psychological level also. These syphilitic persons, I can tell you, if they are going to die, they will not die alone. They will take others also. That is the nature of destruction. I don't like to give an example here. See, they will not die alone. That's why it says suicidal, but suicidal, they will kill others or they will take others also with them. That is the nature of destruction. It is a cellular level, tissue level, organ level, psychological level. That is very interesting. That is syphilitic miasm. You followed it now. I think you could able to make a very distant differences between the three miasms. Pains are tearing, bursting and burning pains. I can give you an example. Like all you have seen the diseases like a cancer. How it starts? Anyone knows? No. That is the phase of each Sowa. Then what happens? Initially there may be some discomforts, congestion, or without congestion there is a growth. Painless, growth, extra growth. The later what happens? Destruction starts, then the pains will come. See, all the three phases you have seen now. Sowa, it has gone to the psychotic phase, then it has reached to the syphilitic, where the patient either crumbles or he dies. This is later added by the Allen. tubercular miasm, the pseudosora at mimicries, mixture of the psycho and syphilitic miasm, changing symptomatology, very vague, weakness, shifting in its location, depletion, dissatisfaction, lack of tolerance, they are very careless, problematic child, very restless child, they all come under this category. Cravings that are not good for them, but still they have a cravings, they want to have that. Pains are great, exhaustion, never enough rest, sun ameliorates, gives some strength. They are very weak in their characters as well as the features. That is typical tubercular miasm. This is added later, but in the basic principles we say the three. Now of late they have started mentioning so many research workers like after tubercular miasm, this HIV like AIDS miasm and malignant miasms, all like things. But the basic principle is same, whatever we talk and say. Here, features of these. See what I was talking psychologically, physiologically, pathologically, emotionally, and so many features. Just examples I give. What are the features we find in these miasms? The mainly, see this is a mind picture of Sowa, psychosis and syphilis. How mentally? The Sowa, they are very quick, active, prostrated by mental exertion, but still they want to do. They are very workaholic. Sadness, anxiety, insanity to kill themselves. See, they will not kill others. The syphilitics are different. And they are never satisfied. They are very moody. They are not satisfied, they want to achieve. See, usually the goal achievers, they are all comes under the Sowa. And number two, the psychosis mind, the suspicious, they are jealousy, they are liars. The liars, because they want to tell so many lies and they want to construct a building in their mind, not in the real thing. They are very selfish and very secretive. That's also accommodative, secretive. You followed it. That's typically their nature. And fits of anger, broods over things, go on thinking the same old things again and again, repeatedly thinking about that. Then in the syphilis, they are morose, mistrustful, imbecility, idiocy. Idiocy means where the mental growth is there up to the age of 3 years or up to the 4 years or maximum the 7 years. Stupid. They are very obstinate and they will not listen to anyone. And symptoms of suicide, that's what I was, slow in their reaction, they have a fixed modes. See here some of the organs also I have taken. For example, in the Sowa, the scalp, what are the changes we see? The dry, scaly, dandruff and dry eczema. Though the eczema is there in all the three miasms, but each one has got its own expression. Hair falls out in a circular spots. I think all you have seen that in the round patches the hair falls off. It may be due to the fungus infection or a viral, that is called alopecia areata. And in the syphilis, it is moist, thick crust formation with eczema. Crust formation with eczema, that is syphilis. And in the eyes of Sowa, itching or burning in the eyes, corneal ulcers and inflammation with agglutination. Agglutination means where this eye sticks. See, eyelid sticks when you wake up in the morning. You cannot able to open your eyes. That is typical agglutination and corneal ulcers. But in the syphilis, we see malformations of ciliary body and iris, which gives rise to what? Blindness. They cannot able to see. They may lose their vision, loss of vision. And the stomach, I have selected only the few. Otherwise, from head to foot, I said no, it may take a long time. Stomach, hunger at night in Sowa, hunger soon after food. They are never satisfied. They eat little, but they want to eat often. And craze for sweets. And in the psychosis, craze for beer, rich gravies and fat food, because they want to accommodate. No, this fat could be able to accommodate. You can just remember, I gave a clue that how the psychotic persons are there. And in the syphilis, aversion to meat. What is the theme behind this? Why you have to understand these miasms? To diagnose for the treatment purpose and selection of the medicines. Number one, establish the concept of miasms. I think I have explained you in brief what is the things. Establish the underlying miasm and dominant miasm. Here I was mentioning some persons, they are soric, the basic. Some they are syphilitic, otherwise also in their expression. Some they are psychotic in their expression. To identify which is the dominant miasm and which is the fundamental miasm. Okay, for that it requires a lot of experience as well as the training. But initially with a clues you may not able to judge that. And for the third point, for the prescription of the remedy, selection of the remedy, we have a group of remedies which has been proved on the human beings. It has been identified, and with their manifestations, these miasms can be identified. Then it is very easy to select the medicines for the treatment purpose. And fourth one, to give the treatment on the basis of miasm or miasms, we say anti-miasmatic treatment. If person's manifestations with their past history, family history, social history, sexual history or menstrual history, like this, all these histories combined together, we try to come to a conclusion that they belong to which miasm. Then we could be able to decide, eliminate the other remedies, what are the psychotic or a syphilitic or a soric remedies that can be given for the patient. To decide the plan of treatment and prognosis of the case, where just I was mentioning, in the syphilitic miasm, we know what is the end of the syphilitic miasm expressions. What is the end? It is a worst prognosis or a death. You followed it, it may not respond. Then our plan of treatment differs. I give an example like that. When you have understood the person is suffering from AIDS, HIV infections, cancer or cancer of a varied things, you know, then your approach differs. See, then you could be able to decide what is your scope and what is your limitation, what best you have to do, what best help you can do for the patients. And number 6, to know the hereditary traits of the miasms in patients. See, some they carry, I said, where the diseases like a leprosy, tuberculosis or a congenital disorders, from where it comes? It is inherited. See, before that only it comes. Means, see, or a disease like a diabetes, so many cardiac disorders, or of late we see many autoimmune disorders, thyroid disorders, all these things we find, where the deficiency disorders, these all may be with the traits from the hereditary that we could able to decide it. And 7th is, to understand the limitation of treatment of case. This is what I was mentioning. Whether you have to treat, if you are treating, whether it is a curable or it is incurable. If it is curable, what is the scope? If it is incurable, what do you have to do? See, in your system, if it is incurable, you understood what you do. See, any disease, for example, cancer, they have identified. What, doctor? Cancer they have identified. We know patient is not going to survive, but he is suffering. What you do? You give some medicine to reduce their complaint, to reduce their pain, to reduce their sufferings. They can live more comfortably. How long they could be able to live? For this also it will help. See, all the systems have got a medicine to reduce the pain. Give us some sedation, give some comfortness, give some sleep or other things. Or we may not able to give a complete cure at the different stages of the diseases. Then number 8, to decide the intercurrent and complementary medicine. You have selected, for example, for acute phase of the disease, one remedy. To complete the action of that remedy, another remedy you will give. I think in your system also it is there, correct? You give one remedy to reduce the fever and other things, to reduce the pain and other discomforts, you may continue with some other remedy. You add to that. See, that is where complementary medicine, which complements the action of the previous medicine, that is complementary medicine. And the 9th is to improve the immunity of the patient. Once you understand they are having the psychotic miasmatic background or a syphilitic miasmatic background or a soric miasmatic background, by giving the constitutional medicine of a psychotic or a syphilitic, we can improve their immunity. We can cut down their sufferings or we can prevent their sufferings where immune system can be improved. It is very necessary for a homeopath to know the miasms. The fact is, we cannot select the most similar remedy possible unless we understand the phenomena of the acting miasm. The true simillimum is always based on the existing miasm. Here the simillimum, the word I am again using. Simillimum means what? You are selecting the correct remedy for the patient. From the patient's understanding, their expression, we are deciding the remedy. See, we make a portrait of a diseased person, we make a portrait of a remedy. That both has to match together. That is what the simillimum. And our understanding is, all the medicines have been proved on the healthy human beings. They have shown their expressions, and by that it is understood. By their physical constitution, by their psychological factors like emotional, intellectual, memory, as well as physiological factor from head to foot in systemic order. That's why to understand, select the miasm, always we have to understand the miasms very clearly. Thank you. Thank you very much. I hope I am within my time. Huh? Yeah. Because the time has been given earlier, that's why we should not extend that, we should maintain. And basically we are physicians. If 1 minute late, by that time, patient may go up. No, we should be. See, in the morning I received one ECG report from a native, where he had a very severe attack of the myocardial infarction. They were waiting. See, night he had a problem. I said, no, immediately you have to rush to the hospital. See, we know the importance of the time in the different diseases. If you have any questions, you can ask, or if you have not followed anything, you can ask. I can clarify, because unless and until the basic things you know, it may be very difficult to understand immediately. It's a little deeper in its philosophy, but I have made to understand little.
Only through this interpretation or going through this different understanding background of the patient, nature, history, the all kind of conditions. I asked because we had also different way of diagnosing the patient through pulse, like urine. So besides that, you have another kind of diagnostic technique that will be easy to assess the problem behind the patient. Besides this, also second question is, you have made 3 parts, this sclerosis and crisis, and so this in one disease, in one disease, these 3 can be also present. Can it be present?
Yeah. That's what I said, the different phases it will go.
So then...
Initially start with an itch, that is Sowa. Their functional disturbances will be there. Many times that is ignored, or that is not treated properly. Then they will go to the stage of psychosis.
Yeah. So you said, to really get a good treatment, to get good results, you should know these different stages. So each stage need different treatment actually,
Naturally.
Yes.
See, when that expression is there, during that time, what is that phase, we treat accordingly. And your first question I will answer, then we will come for this. See, you are asking about the different tools, whether you are using to identify the patient's problems, like a pulse, reading the tongue, seeing the urine, seeing the stool. This is all part of physical examination. It's not a separate entity. See, if we see the pulse, by that we could able to identify whether they are psoric, they are psychotic or syphilitic. That's why I said, I gave in brief about the 1 or 2 organs, like a scalp, head, eyes, nose, ears. Then when we come down, heart, cardiovascular system, pulse, everything will come. It doesn't mean that we are not examining the patient. To take the history in detail, it takes time. Then, for example, the pulse only. For example, I said very weak pulse, very weak in its nature, that we consider that is a Sowa. Very strong bounding pulse, that is psychotic. Then very weak collapsing pulse, that is syphilitic. See, we identify, because we came from the modern medicine history background, we do all the investigations. But we don't rely on the only investigations. For example, you are asking about the urine. By the nature of urine color, If it is a red urine, we have a different medicine. If it is a yellow urine, we have a different medicines. We have a, what I can say, like a muddy urine, we have a different medicines, like that, by the expression of the things. It's naturally, it differs. Okay? Not only with that diagnosis. Yes? I hope you have enjoyed, you understood something. If you remember these three words, what is that? Sora, psychosis, syphilis. I have made a concise form of this. They are we have made a concise form of this, what I have given now. It is a very small, brief explanation. As I said, each miasm, to explain that, it takes a long time. As we remember, what are those? One is miasm. Under that, Sora, psychosis, syphilis. The fourth one is added later, tubercular. Tubercular, easy to remember. Tuberculosis, we call tuberculosis, TB, tubercular. It's easy to remember. Sora, psychosis, syphilis, and tubercular. Here afterwards you meet any doctor, no, you say about this. And I hope you will remember my name. At Saranath, Varanasi, we have heard first time the words miasm, Sora, psychosis, syphilis, tubercular. Yeah, very good. Individualization. No, without that it is not possible. Though you are here, some 20, 25, all are different. You have a different options. You have a different likings. You have a different taste, different desires, different likings, different habits, different nature of sleep, different nature of hairs, different nature of skin, different nature of sweating and perspiration. Everything you take from point to point everywhere, you find you are different. That's what typical individualization we are supposed to know. Thank you. I think we had a very good hearing and patient hearing. I am very much thankful to you. I thank the organizers. They could be able to give me an opportunity to come and share with you the views of this homeopathy. I thank you. Thank you one and all. Thank you very much.